So I know there's a few other people from immunization in the room. For everybody else, I'm going to be quite basic and start from zero. So now that you're all fired up, let's maybe take a step back and look at immunization. All right, just to say that in the resource folder, I put in some extra resources for you to look at, so I will keep this short and crisp. Try to keep under the 15 minutes that were allotted. But in the resource folder, I put a slide deck with immunization coverage and kind of the state of immunization globally. I also put our Immunization Agenda 2030, which is the strategy we have for immunization for the next decade, which is already almost half underway now. And also I put in a guidebook that we actually wrote when I was still at PATH, which was basically aimed at program managers or program staff to say, hold on, you're going to do this digital health project. We often do that, API people, we often do that kind of almost as hobbyists, right? And we wanted to make sure that people took a deep breath, said, okay, we need to team up, we need to work with digital health people, with other people in the Ministry of Health, and there's all these things that need to be in place before we embark on this exciting but complicated project. So I'm not going to talk about that, but it's also in the resource slides. So these are the objectives. So I'm going to talk about the priorities of immunization program countries at country level. Just a spoiler, it really depends on what country you are, but there are some common themes that I will try to talk about. First of all, for people who are maybe not familiar so much with EPI, and EPI, by the way, is the expanded program of immunization. It is what WHO started after the eradication of smallpox, and based on that success, WHO and other people in public health, CDC, and other people thought, you know, let's build on this momentum, let's really use vaccines technologies, roll it out, make it universal. So they had this dream, and as you see on this slide, there were actually 6 initial antigens. I won't do a quiz, but there were 6 initial antigens that were started EPI, and it actually got a very quick uptake. Oops, did something wrong. Chris, can you put on the slide? Sorry about that. So we had an initial really fast success, fast uptake, and then actually maybe a plateau. So we were a high-performing program, but we really always struggled a bit to reach the last 5th child, the last 10th child, whatever that was. So there's this plateau of performance here. So we're at 85% coverage, which is really good, but we really also want to focus on the last 15%. At the end of it, you see the dip by the pandemic. So it was a meaningful dip, but in the big scheme of things, it is still manageable. And now we're trying to reconnect with the success of before. What I want to highlight is also that in the meantime, we didn't just improve coverage and made this a truly universal program, but we also introduced all these new vaccines. So from 6 universal antigens, we went to 13 universally recommended antigens. And then there's as much as 17 additional vaccines, which are context, regional, epidemiological specific vaccines. So that's actually quite a lot. And within that uptake of these new vaccines, you really see the role of Gavi. So when the Gavi Alliance came into being in 2000, all of a sudden these new vaccines that had been around, like Hep B, they really were taken up very fast. New vaccines like Rota, Pneumo, HPV, that really before would only have been rolled out in rich countries, were now rolled out universally. So that is really a very big success that we want to celebrate. But beyond the successes, we also want to really look critically at what we don't get and the remaining challenges, because I think this is more important for our discussion today. And the main challenges that I made, if you see again, we have this very high coverage, so 90% of children worldwide are reached by at least 1 dose. If you think about that, that's enormous. The birth cohort is like 132 million children per year, so we reach more than, country programs reach more than 100 million children every year. Sustainably every year over and over again, and they complete schedules. So that is actually a very big achievement. But we want to focus on the ones that we don't reach. And we see that there's actually right now about 15 million children, so 10% of the children worldwide, that are not reached at all. We call them zero-dose children. Some people like that word, some people don't. But it's a concept to say there's a lot of left out, never reached, never benefiting from immunization children. 15 million, and we really want to, you may want to plug in the power, thanks. And we want to really target that, and this is one of the main focuses of the next strategy that I will talk about. So other things that haven't really happened is we keep on talking about life course vaccination. So I see people from Euro here. In Euro, life course vaccination is a thing. In many of the lower and middle income countries, it's not, right? So we don't reach, we reach adolescent girls, we reach pregnant mothers. We're really struggling with adult vaccination, to be honest, like influenza, COVID now. Other programs are really hard to establish in lower and middle income countries. That's still an open agenda. And by the way, finally, we also struggle with disease elimination, let's be honest. So API was started on the back of eradication of smallpox, and the idea was that new diseases could be eliminated and can be eliminated. We're very close to polio. We've been very close for a very long time. But measles, for example, is still quite a way off. This is, for example, measles, the numbers that are reported to us. So you see that this is a cyclical thing. Sometimes we have this big outbreak, as in 2019 globally. Then there's a bit of more natural immunity. There's also like big campaigns. We get measles down to a very low level, and then you see it's building up again. So now there will be again this big tsunami of measles coming up at us, and we won't be able to control that unless we, of course, really get high coverage. So what do you do as public health people? If you see these problems, you make a strategic plan. And then I'm going to talk about the strategic plan because I think this has some of the priorities that we have as a global immunization program, at least. And just to be honest, so I put this strategic plan in the folder that you can all look at, and you will see that it's very ambitious, it's very broad, and everything is a priority, as most public health plans are. Now, I just want to highlight a few of the really key things that we say in that plan, though, and one of the first things is life course. So more vaccines. You know, we came from a simple program with a few vaccines all in the first year of life. Now it's a longer age range. There's more vaccines. So this record keeping and the personal record becomes very, very important, of course. And this is, of course, linking into what we will talk about later with the digital health interventions that we want to prioritize for immunization, including the personal record and the immunization record keeping. There's also a second priority, which is at least as important, which is the Leave No One Behind agenda. So we see that at the global level, we set 15 million children, but of course, in many countries, it's much more than that proportionally, right? So we think it's really important to work on this equity, not just because of the sake of equity, because also because we think that without reaching everybody, all communities, we will never be able to eliminate any disease, and the public health goals will also not be fulfilled. And finally, this new IA 2030 strategy has a very important focus on integration and primary healthcare. I think times are behind us where EPI was really this very siloed, focused programs that thought that we can do everything without anybody else. So that is not true. A lot of the interventions that we need to happen and actually to improve immunization need to happen in this PHC, UHC, and the health system, right? A lot of the interventions, and this will again be very relevant when we talk about digital health, I think, is we need to see improvement that are not just immunization improvements, but we need to see improvements across health system blocks. So this is very important also. So I won't bother you with all the indicators. We have a lot of them. Just to say that maybe the key indicator is that if we are able to implement all these improvements, immunization has the potential to save 50 million lives over this decade. So it's actually something to maybe think about. So immunization right now can avert about 4.5 million deaths per year. So if we would stop immunization right now, that's the number of excess deaths we would have. But even if we would get to 90% coverage and introduce all these new vaccines, we can actually push that a bit more to maybe 6.5 million children and people per year that, because of the fact that they're immunized, will not die of vaccine-preventable disease. So that's actually quite impactful, and we need to keep that end goal in mind as well. And to get that, maybe to say that we want to reach 90% coverage for all vaccines, and maybe specific for this immunization agenda, we have this very specific target that number of zero-dose children, we want to halve it by 2030. And wherever you are, wherever context it is, if you have a lot of them, few of them, you can still work on trying to reduce that number. Moving on. So Of course, 90% coverage with the first dose and 84% with the last dose looks very good, and maybe we shouldn't be worried. But actually, if you look at global average, it really obscures what happens in the countries, right? And I'm showing this slide. I'm going to dwell a little bit on it because I think it's also important to say, if you ask, what are the country priorities? I think it really depends on what country you're talking about, right? Here, for example, maybe just to explain how this chart works, at the x-axis, I have the prevalence of unvaccinated children. So the percentage of children in the country that are not at all vaccinated, right? So you see that, for example, in Sudan right now, because of the civil war, more than 40% of children are not reached at all, right? Sudan also, in the baseline year in 2019 we had a very good performing program. So they went from this line of equity to out there. So they worsened their performance, of course, because of the war. That's normal. The same thing for Yemen, Somalia, Central African Republic, Venezuela, all countries in conflict. And by the way, all the orange bubbles here, and they're scaled to show the number of zero-dose children. They're all countries with some fragile context, with conflict, with fragility, with vulnerability. So PNG is the worst performing, together with North Korea, but that's a very specific situation. Now, what we want to do is kind of bring all these countries back to a reasonable number of zero-dose children. So at least, like maybe less than 10%. But anyway, so just to say that the problem we have with global immunization is not the global performance. It is the underperformance in very specific countries. And unfortunately, these very specific countries have very specific and very hard to overcome challenges. If you're, for example, in Nigeria, you have insurgency in the north, you have a health system with a lot of challenges. For example, even if there's already very few healthcare workers, they're not getting paid regularly, and then all these things that we try to improve, basically, they're built on the basis of fragility, right? And that becomes very hard, of course, to work with. And I think we need to find ways to work with countries in conflict and with countries with very poor health systems as well. But we need to be also a little bit cognizant that progress there might not be as fast as in other countries. Here you see, for example, India. There's a lot of people from India here as well. Is still a large bubble because it's such a large country, 25 million children born every year. But they actually have less than 10%, maybe something like 5-6% zero-dose children. So they actually made a lot of progress after India eradicated polio and really could start working on health system improvement. So that's also something to keep in mind. So just to keep this in mind, like for some of these countries, the interventions and even the digital interventions that we envision might not be the same as for other countries. Just think about the context. Another thing is demographics. So is demographics, is it destiny? Some people think so. It's probably not. But just if you just look at these 6 panels, what really jumps out of that is the population growth in African countries, right? So the world's birth cohort has started to decrease, which is actually a good thing for coverage, because what it means is that you don't have to immunize more and more children every year just to keep up. Now, if you're in a country in Africa where every year there's 5% more children, you need to immunize 5% more children just to keep coverage equal, right? So it's like swimming in a river. I don't know if people swim in rivers here, but if you swim upstream, it's much harder than if you swim downstream. So in Asia, a lot of the current has been supportive. In Africa, it's still really hard because also like the health systems are already restrained, capacity is low, and more children need to be going through that health system. So what do? We keep on looking like graphs at that. We said, oh my God, we are not reaching the targets. We're definitely missing the targets, so what is happening there? And then I couldn't resist putting in this cartoon that I saw from the New Yorker magazine that says, I don't understand it. We had all those meetings. Why is coverage not going up? Well, maybe we have to get really active also and do things. And of course, one of these things that we can do and we should do, and that a lot of people put a lot of hopes and investment and future and vision in is digital health and innovation, right? And so maybe we can talk a little bit about that. So we conceptualized it in 3 big buckets, and I think digital health, so the first big bucket is kind of these management systems, like making sure that everything in your system works well, that the vaccines are there. And I think one of the things we will talk about is the supply chain systems, which of course are also like a health system thing, right? Supply chains are not there only for vaccines, they're there for all the health products. Now, vaccines is a bit different because it's refrigerated, it has a different planning cycle, etc., but it's still a supply chain system. So the management system around those supply chain systems could probably also be more harmonized. But beyond that, there's the more intractable thing, the human resource, the financial management, and all these kind of foundational investments. So I'm learning, so I learned about DPIs and the foundational DPIs, and I probably would have said this differently, but even like, for example, the ability to pay health workers for outreach, for operational cost through in a foundational payment system would be amazing for this management system, right? So in the middle, we have the health data. So we have the reporting. So I think immunization moves beyond kind of parallel reporting system only for immunization. So we're integrated into HMS. I think the next big thing that a lot of countries have gone through or are going through is actually personalization of that. And not just counting children, but really making sure that everybody has their own personal health record, and also that we give a name, face, a need to every individual. So that is the next big revolution. So the immunization records, the EIRs and whatnot. And of course, out there are also population data, which again is much more beyond the immunization scope. So we all share a population, we share a geography. So the geographical information systems, the geospatial service and the public-facing applications that could also be very useful for immunizations are probably also very useful for everybody else. So we would also like to co-invest in all these things to make sure that we reach our goals and PHE reach their goals. So with that, so I've been thinking that this Q&A is a bit intimidating, this roaring lion. So I thought I might make it a bit more welcoming. So I don't know if there's questions now, time for questions now. If not, I'm also available throughout the 3 days.